Good morning, everyone. Today I'm going to talk about professionalism. As you all know, I am doing my field experience on currently at the hospital that I work on our geropsych floor. Excuse me, I have a really nasty sore throat, so if I'm drinking coffee in the middle, I'm so sorry. Um, but I'd like to talk about professionalism, how people speak to the patients that are on the floor, and how not patients, I'm sorry, staff interact with other staff members. Um, it's a pretty tight-knit group that works on that particular unit. They're actually very, very good at what they do in working with these individuals. I've actually gone to them the nurses on the staff, gone up to them a couple of times and have asked them how to best go about speaking to an individual that has some deficits and is either nonverbal or just really doesn't understand what I'm saying. Because a lot of these patients have Alzheimer's, dementia, multiple personality, schizoaffective disorder, that type of thing. Um, so my as a common courtesy to them and as a part of professionalism, I do consult with the nurses in regards to what patient would be best for me to be able to sit down with, spend some time with. Um, Especially if, there's a particular nurse that's covering that patient. I want to make sure that I'm not intruding on anything that she has to be doing with this patient. They do have some activities on the floor. I want to make sure that I'm not um, intruding on that time as well. Um, what I've noticed is not all of the staff, but some of the staff, in the way that they interact with each other and in the way that they interact with the patients. These patients are older individuals, 60s, 70s, 80s, even in their 90s. And even though um, they have some memory deficits and they have some other issues going on where they can't articulate what they want to say in a certain way, or they're nonverbal at all and can't get their point across. The way that I've watched some of the staff speak to some of these patients has kind of been a little disheartening to me, and they're not doing it in a bad way, but to me, in order to be, well, in order to, I guess professional, I guess the word's professional is what I want to use, but I don't agree with the way that individuals speak to patients. When you walk into a room and you're meeting your patient or your client for the very first time, you don't go, "Oh, hi, honey, how are you? How are you doing today?" That's not, to me, that's not professional. I don't think that it's appropriate. Um, this is an individual who has earned the right to have the respect and not be spoken down to like they're a 2-year-old. And I understand that it's a habit. I used to do it when I first started in nursing. You know, a patient would call me and be looking for something, and I'd be like, "Okay, hi, hon, what do you need? What can I get for you?" Um, and I very quickly learned that that is not something that people appreciate, especially an older individual. Um, but this happens quite a bit on that floor, and I think it's due to the nature of the illnesses that these individuals have, and that the staff members are trying to make them as comfortable as possible. But there was an incident where there was an individual who's pretty well semi with it, and a nurse had gone in, and I had happened to be walking past the room with an individual that I was working with that day, and referred to her as sweetie, and the patient was very upset, did not like it, and basically said, I'm your elder. It's either Mrs. So and so, or you can call me by my first name, but please do not call me sweetie. I'm not a child. um so that kind of opened my eyes a little bit, because I try to be very conscious of that when I'm working, mainly because I'm at home with multiple little children, and that's usually what comes out of my mouth constantly. So the nurse was very apologetic and said, "Oh, I'm so sorry. It's just something that I say. It's a habit." And then 20 minutes later, after that conversation with that particular individual, she did it to another patient on the floor and continued to do it throughout the day. So clearly that had no, and she did repeat calling that particular patient sweetie again. And I'm not sure if she just gave up and decided that, hey, this is how it's going to be. But it showed me, just from listening to the interaction between the patient and the nurse, it showed me that the woman felt demeaned. And that she was like, I'm 84 years old. I'm not your sweetie. I mean, old people are cute. They are. There are some of them that are just absolutely adorable. But should we go up and run and tell them that they're absolutely adorable and, oh my goodness, we want to squeeze their cheeks? No. Um, I understand where a lot of the staff gets that from, and why they speak that way. But these individuals are individuals who have lived their lives. They're 70, 80. They've had a long life. And just because they have a disease such as Alzheimer's or dementia or major depressive disorder or whatnot does not mean that because they can't communicate like they once did, that they shouldn't be referred to as a Mr. or a Mrs. Um, I did witness a couple of nurses going in when we get new admissions and saying, what do you like to be called? Mr. So-and-so? Do you want your first name? Which I think is wonderful. And it's a common courtesy to the individual that they're dealing with. The honey babe, sweetie language is not conducive to that type of environment. I don't feel that it makes the staff look good, and it sure doesn't make the patients feel good. Now, that was just one particular individual that I was able to witness, which was why I was bringing this up, because I don't think professionalism is just in the way we dress and a whole bunch of other stuff. It's in the way that we communicate with individuals and in the way that we speak to them. And I think that these are individuals that, have deserve the right to be spoken to like the adult that they are, regardless of whether they can communicate with you or not, or they can remember your conversation 10 seconds from now. I don't think that they should be treated like children, because they're not. The disease that they have is debilitating, extremely debilitating, and life ending. And these individuals have lived their life, and they deserve the dignity and the respect that they have earned. And I feel that it's very important that we as professionals pay attention to that, and that we treat them like the adult that they are and not like a child. Um, so I guess I know this video seems a little scattered. I did have a whole bunch of stuff written down, and I just kind of got off of that because it really wasn't working very well for me. Um, but like I said, as far as professionalism goes, I mean, I didn't I didn't say anything to the nurse because it's not my place to do so. I don't work on that floor. Um, I just wanted to I just wanted to bring it up because I'm trying to make myself more aware as well when I'm with these individuals, to make sure that I'm not doing this type of behavior. Um, and I've asked my field instructor to kind of look out for that, because this is conversations that we've had in the past in regards to how staff speaks to patients. Um, and it's also very important when you're in an open area. And now this is a locked unit, so people have to come and go and be buzzed in. But still, there's a lot of staff needs to be professional around other employees in the hospital as far as information in regards to patients. I've noticed that doesn't happen a lot. There's a lot of talk right around the nurses station, because it's mainly the main center of the floor. But in regards to patients' protected health information and whatnot, there are certain individuals in the hospital that don't need to know um, what that patient is here for, what's going on with them. So I think staff needs to be more professional in that aspect, and not have those types of conversations while there are other employees around in the hospital, or even family members that are on the floor, because most of these patients are brought out of their rooms and are in the hallways or in the common room, and there are visitors. So it's very important that staff needs to remember to be professional in that aspect and go to a different location if they need to discuss a patient. They have conference rooms and little alcoves where the doctors can be to discuss individuals. So that doesn't happen very often either. A lot of the conversation and whatnot gets done right at the nurse's station. Um, so I'm just hoping that one of these days it doesn't come back to kind of bite them in the rear end. But again, back to professionalism and in regards to speaking to individuals, I think that maybe there needs to be a class in regards to how to speak to an adult, because a lot of the staff on the floor treats these individuals like they're children and they're not, and that is something that kind of bothers me actually quite a bit, because that if that was me or one of my loved ones being spoken to that way, I'd be a little bit upset. I think they've earned the right to be called something more than sweetie, honey, um, pumpkin. I mean, there's a bunch of other names that I've heard them call these patients. Um, and there are some of them that get it. There are some of them that know and will look at them and give them a funny look and be like, "Well, that's not my name." And so it's kind of confusing to them too in regards to the type of diseases that they have and whatnot, the altered mental status. So um I know this is rambling, but so I guess I don't know. My question to you would be is in regards to professionalism and communication and speaking with an individual. I mean, do you feel that my opinion is way off and that I'm just kind of being nitpicky, or do you think that it's inappropriate to call a client or a patient, whoever it is that you're dealing with, a term of endearment instead of their name? I mean, would you go in and say, "Hi, what would you like to be called?" Or do you instantly go in and say, "Oh, hi, sweetie, my name is so and so. I'm going to be working with you today." Um, because that would just put me right off. I think I would probably, if I could and had the ability to do, I probably would walk out of the room. Um, but that's something that I'd see a lot of, not just on the geropsych floor, but all over the hospital. The only one place I don't see it in is the ICU. So, yeah. So that's my video. Looking forward to all your responses. I hope you all have a good week. Thanks.